morning, it's Friday, March the 10th, and it must be time for another legislative update from your North Carolina Medical Society. It's been a busy week, so let's start up at the federal level. This week, the American Health Care Act was introduced. This is supposed to be the replacement bill to Obamacare. As it is, it really only addresses Medicaid. And because of that and many of the other elements that are written into this bill, there are lots and lots of problems with it. Lots of financial impact coming back down to North Carolina. Not the least of which is it looks a lot like the SGR problems of old by picking the 2016 numbers to basically predict all Medicaid money going forward. From here on, our money for North Carolina, our share for North Carolina would be based on the per person share in 2016, and that would be it. Sound familiar? Lots and lots of problems we're identifying here. We're putting together an action alert so that you can talk to your congressional delegate this weekend. The bill went through finance very quickly this week. It's expected to go to budget next week and then on to the House floor. So now is the right time for you to reach out and talk to the congressional delegation. Look for that in your email or look for that on our website. Coming back down to North Carolina, a number of bills that we've been tracking have moved this week, some in very short order, but the one that I'll highlight for you is the opioid bill. The STOP Act was heard for discussion in House Health. We've put up a summary of the bill and a description of what happened in House Health on the legislative blog, so be sure to look there. But now's the time to be reaching out and talking to those sponsors, sending them messages about your concerns because we're in the process of making adjustments to that bill. So we've heard from lots of doctors about the mandate itself. We've heard about the pill limit on acute pain prescriptions. We've heard about the kinds of drugs that you would be required to enter into the CSRS or check the CSRS about. So we need you to make sure that you're contacting your legislators or the bill sponsors about your concerns so that those can get addressed along with the concerns that we're raising on your behalf. And finally, I would highlight the nurse bill. We've talked about that in previous action alerts. Many of you have already used the action alert to communicate with your North Carolina legislators. We've heard that that may come up as soon as next week or in the next couple of weeks. So as you continue to reach out to your legislators and have those personal constituent conversations, be sure to have a conversation about the nurse bill and your concerns about physician supervision going away, since that's the principal piece of this bill that would be different from what we're doing right now in North Carolina. So I hope that you'll take the time over the weekend to look at the legislative blog to get a little bit more of a detailed update about these bills and others that passed this week. Take action with your congressional delegation to make sure they understand the concerns and the impact that will happen in North Carolina if they pass the American Health Care Act as is. And we look forward to talking to you again next week about these and other issues going on in the General Assembly. Have a great weekend.